I'm a second-year student at ESP, and I'm from Toronto. For those who are from Toronto, I'm not actually from Toronto. I'm from Newmarket, but it's easier. So yeah, I'm here to represent the Canadians from ESP. I've been talking to a bunch of the alumni throughout the spring of last school year, and just gaining some insights on how ESP was for them and how the transition was to working as a physio in Canada. So yeah, after talking to them, I gathered three speakers that I'm very grateful are here to kind of share their experiences and their expertise on all things physio in Canada and related to ESP as well. So yeah, we've got three speakers tonight, and I hope you guys enjoy.
Thanks. And thanks for your hard work, Katie. That is the first thing I wanted to say. It's a nice project for us, and definitely a nice way for students and alumni to interact. So it's a recipe we definitely will continue. I just have a few minutes of a couple of special words for our Canadian friends and everyone else interested in Canada. But before I do that, also thanks to Aviv for all the online assistance in the preparation, so that especially with the last minute updates, we managed to get everything ready. We definitely have a long list of people that signed up, so that's nice to see. Just for your information, we're gonna record this session, and then we're gonna edit the session and share the individual talks with you, hopefully soon via YouTube. So then you can find it also via the blog post, same blog post where you could find the sign up form. So the idea is that, yeah, with this session, we try to strengthen our connections, and definitely within ESP, we have many different passports. As you know, Canada has always been, a big country for us for different reasons, and we've always been quite pleased with the Canadians. But we've also learned that in the last years, the network has grown, but we kept doing a lot of individual contact with individual alumni. And the goal after this meeting is also to try and share maybe a little bit more within Canada, so that it's a little bit more efficient and also easier for you to connect with other ESP alumni that might be around the corner. Now, I know for the Canadians that is already quite a strong network, but in other countries we've seen that is something that maybe these webinars or these kind of projects could help with. So that's basically our goal, and for Canada, we've started this long time ago already, but now finally with a nice webinar. Canada is still in the top 5 if you look at all the alumni from ESP history, and definitely in the last few years, we saw a lot of very talented Canadians come to ESP, but very often also go back to Canada, and that's where also we got a lot of information from about the system, about registration. And definitely now also with the internships, we see that many Canadian alumni are also helping with internships, etc. So it's a nice network, and definitely, a great collaboration. I think that, we've strengthened or tried to strengthen also a couple of years ago. This is a couple of pictures where you see that we tried to visit, for example, David McGee and University of Alberta, but also alumni in the Toronto area, including Carolyn a couple of years ago, just to make that connection even stronger. And hopefully now after the whole Corona pandemic, maybe we can pay Canada another visit to see what we can do together with internships or maybe other interesting things. Especially for current students, this webinar might be interesting, especially in combination with the documents that we already have provided about Canada, just to get some extra info and advice about registration. We've seen the K performers many times, especially Marguerite. Probably will dream about these forms every now and then. So we know exactly how to complete them. We also now know how to mail them according to the right instructions. So I think we can definitely help you quite easily with that process. But still, with the written exam and the practical exam that the Canadians have in place for you, some advice from the seniors might be good. So feel free to ask that today after their talks if you like to know more. And then we try to, or at least Katie definitely tried to make it interesting with a good mix of people, different backgrounds, different career paths, different years of graduation. So I don't want to spend too much time talking about the whole project and just leave everything up to them. Also, Mirai is here on behalf of the internship office. Miriam, as internship coordinator, will tune in a little bit later. So also internship related discussions we can definitely have maybe after free talks. And then unfortunately, because it's virtual, we cannot offer you a real drink. So hopefully you can take your own drink. For the Canadians, maybe it's a bit early. I don't know. But for us here in Amsterdam, we will definitely have a drink afterwards. But yeah, maybe in the future we will be able to meet again with a reunion or something. But this is, at least for me personally, a nice small virtual reunion. So yeah, I'm just gonna sit back and listen to what you have to say. So we did already a few technical checks, so that should hopefully be fine from now on. If you're ready, Afshin, then I would like to hand it over to you, or maybe Katie, if you want to add something, feel free to do that.
Yeah, I'll just give Afshin a little introduction. So Afshin is a recent graduate of ESP. He graduated in 2018. So has been through the registration process quite recently. So he can give us some insight on that, which is great. And then also his experiences as a new physiotherapist in Canada.
Well, like I said, pretty basic presentation, so don't think it's I just put this together. So I'm going to discuss a little bit mainly about the registration process, as Katie mentioned. I graduated in 2018, and I went through the process obviously as soon as I returned. So, and this is a good time to do the this webinar, I think, because there's been some big changes, which I'll get to the clinical component of the exam. So very good time, like I said, to do this, because it's going to be different than what I did and what previous alumni have done. Okay, but the first part will be similar, so I'll start with that. Everything's okay with seeing everything, right? Yes.
Yep, all good.
Okay. Okay, so this first step is to get everything credentialed. So as Bas mentioned, there is a lot of previous alumni, so that shouldn't be a problem from ESP. It meets all the requirements in terms of, that's not substantially different from the Canadian program. So that's the first thing that the CAPR, which is the Canadian Alliance of Physiotherapy Regulators, needs to check. They just need to make sure that the education that you've got is not, like I said, substantially different from the Canadian program, which ESP is not, so you're all good there. So I would recommend step one to just going onto the website and just reading everything thoroughly, because they do put it out very clearly. So it's a very good website, and the way they've organized it, it's really good. So that should be step one. So the next thing you want to do is you want to gather all your documents after you go through the website and seeing everything that you need, all the forms, like I said, pretty clear there. So there's two types of documents. Some needs to be provided by you, and then some needs to be provided directly from ESP. So I've listed them on the slide, as you can see. So the documents you need from you are the signed application form, the credentialing fee, which I'll get to. It's about $1,400 Canadian. There's an application checklist. You need a copy of an identity document, and then a notarized copy of your physiotherapy degree from ESP. So those need to be sent in by you. The stuff that needs to be sent in directly from ESP are, again, these are all on the website, but it's a document request form, is supervised clinical practice hours, academic record, which is your transcript, and then a graduation verification form. Again, Marguerite, like Bas, is probably an expert on this by now. The third thing is a language proficiency test if English is not your first language. So that didn't apply to me. So maybe I think ESP requires something like that too. So it should be very similar, just your basic standard language test in English or French. That's what it said. And then lastly, you need to do an online course, which is physiotherapy within the Canadian healthcare system. And that's just to get you acquainted with the specific stuff that are required and how physiotherapy is a little bit in the Canadian healthcare system compared to the rest of the world. And you will do that. I'll get more into it after you submit your application. You have a bit of window while the credentialing process takes place. Then that's a good time to sign up and do that online course. So how much does it cost? To be exact, it's $1,415 Canadian. That's for the credentialing process. And how long does it take? You have precedent and non-precedent cases. So the precedent cases are if there's been a previous graduate from that university, which there's a lot from ESP. So ESP falls under the precedent. And then there's non-precedent, which you don't need to worry about. That's if you're from a new university program where there hasn't been a previous graduate there. So that just requires more time for them to go through everything. So being a precedent case, it still takes 10 to 12 weeks. So what do you do during this time? You complete the mandatory online course that I mentioned in the previous slide, and then you can also start preparing for the written component of the PCE, which is the physiotherapy competency exam, which I'll get into next. So that's the next step. So after you submit everything with the payment, all the forms are in. Now it's that waiting game, 10 to 12 weeks. Okay, so you've taken your online course, you complete that. Next step is once you get the results back and everything is okay, and it should be, like I said, if you go through the process correctly and there's no missing forms or anything like that, then you need to sign up for the written component of the physiotherapy competency exam. So again, forms are all on the website. You print it, and with the payment, which is $1,368. So you add that to the 1,415. So this is for the written exam. It is offered about 5 times per year, and it is 200 multiple choice questions encompassing, again, there's an exam blueprint which you can go on the website, but it's musculoskeletal, neurological, cardiorespiratory, a lot of ethical questions from what I remember as well. That was a big component of the exam. And those are the 4 main categories that the questions are based on, which again, ESP should prepare you pretty well to write the exam. So once you complete that, this is where things change. So starting January 2022, the CAPR is no longer administering a clinical exam. So the exam that we did and the previous alumni did with the OSCE stations is no longer there. So now, and the reason for that, again, I didn't do too much into it, but there was a lot of problems with, the pandemic and backlog of applicants and residents waiting to write the exam. And then there was a shutdown of in-person stuff, obviously, due to the pandemic. So there was a delay there, and there's still a lot of residents waiting. So I'll talk about that again later. But I don't know if that was one of the reasons, but they've decided to scrap that, and they're doing a new clinical exam, which I'll talk about. So each province now is going to have its own, issue its own license. So I'm not quite sure about the other provinces, but Ontario, which is the province that I reside in, the College of Physiotherapists of Ontario will be administering what's now called the Ontario Clinical Exam. So this will be it's an interview format. So it's no longer an OSCE where you go station to station and demonstrate hands-on clinical skills. That's no longer there. I'm not sure if that's a good thing or not. Now it's going to be an interview format. So it's 2 parts. The total duration, from what I've read and heard, it's about 3 hours. They're going to be starting. So the first one's actually going to be October, in a month. So that'll be the very first one that's going to be offered. So it's a little bit of an unknown factor. Nobody really is going to know what it's like, especially people like us who did the previous clinical exam. So what it will entail, according to the website, is that candidates will be provided with scenarios that will require them to draw on their own knowledge and then give appropriate answers. So like I said, no longer hands-on demonstration of clinical skills, and you will not be going through station to station and doing the OSCE as it was done previously. The fee is $1,985, so $1,985. So this is all adding up. So keep track of how much everything is going to cost. So this is for the clinical component. And the good thing is that this will be offered, I think, 5 to 6 times per year, whereas the previous OSCE station was only offered twice a year. So that'll speed up the overall process a little bit because you don't have to wait as long. So the Ontario Clinical Exam is going to have 2 parts. So the first part, there's going to be 2 case studies, which will be presented to the candidate based on 2 different clinical and practical scenarios. And then the candidates will have to analyze the scenario and respond to the question. There will be 2 examiners asking you questions and then evaluating you. So there's 2 sample cases that are there. And then so this 9 component, the questions will be based on these 9 subcategories. So the first one is accepting the patient, assessing personal knowledge and appropriateness for physiotherapy, and then informed consent, clinical examination, clinical impression, recommendations. And then the second case could involve developing a treatment plan, developing goals, patient collaboration, consultation, referral, monitoring, reassessing, modifying the treatment plan, and then discharging or transitioning the care. Again, like I said, I'm repeating, there is no, so this is an interview format. So you're going to be talking to somebody and answering questions, no hands-on clinical skills. Second part of the OCE, a vignette will be presented to the candidate for each of the following core questions. So again, subcategories, there's 11 now. A scenario will be presented to you, and then you're going to have to, again, read it, answer the questions, whatever that they decide to ask you. But it will be based on these 9 subcategories. So supervision, assigning care to support personnel, so PTAs and rehabilitation assistants. A lot of physios work with PTAs here in Canada. Expectations regarding fees, billing, and account, addressing discrepancies between employer expectations, professional standards, conflict resolution, confidentiality, privacy, infection control and prevention, professional boundaries, ethical issues, prioritizing care and time management, physical and emotional safety of the patient, and communication strategies. So there's a lot, it's very broad, and this is how the preparation for you is going to be, just making sure. And to say the previous OSCE stations did involve a lot of these as well. So before you would go, there'd be a case on the door, and then you would have to read it, have 10-15 minutes to prepare, and it would be something along these lines as well. So they've only really changed that component. Now, instead of you going and physically entering a room, there being an actual paid actor patient, that's no longer there, and you just have to verbalize what you would essentially do. So that's really the big difference, I would say. And once you complete the clinical exam as well, you are registered to practice as an independent. You get your independent license and you can practice. Once you pass your written component, you can practice as a resident. You will need a supervisor. That can be any person who registers on the website as your clinical supervisor, and you are allowed to work under that. That person doesn't have to be at the clinic that you're at. It just has to be someone that's comfortable enough with you and will put their name down as your clinical supervisor on the website. So you are also able to do that while you wait to do your clinical exam. Again, a lot of uncertainties now with this new exam. So yeah, it's probably gonna have to get some alumni in the future who do that exam and have this webinar again for them to tell you more detail, because it's different than what we did. The clinical component anyway.
Perfect. Okay, thank you, Afshin, for your time. That was great. We're going to move on to the next speaker, who's Pascal. He graduated from ESP in 2012 before returning to Canada, and now works owning a successful mobile physiotherapy service in British Columbia. So Pascal is going to give us some insight about his journey as a physiotherapist and the scope of physiotherapy in Canada.
Excellent. Thank you, Katie. So first things first, sound check. You guys can hear me fine? Excellent. Okay, so let's try the screen sharing thing here again. How's that?
I can't see your screen.
Okay. How about now?
Perfect. Yep. Got it now.
Okay, perfect. So I'm going to zoom out a little bit and talk a bit more about physical therapy from the perspective of an ESP graduate in general, and then dive into some of the topics that Afshin has talked about already, and maybe add a few pieces to the puzzle, and talk a bit about work opportunities. That's mostly limited to BC because that's where I reside and have lived ever since coming back to Canada. And then there'll be hopefully a good chunk of time for Q&As about all the pieces that I haven't addressed. You've already introduced me, so there isn't much more to add really. I started my own mobile therapy clinic as soon as I came back to Canada, well, with 1 year delay after I was fully registered. And I'm still running that. I work about 3 days in clinic, and the rest of the time I spend with other bits and pieces. Throughout the pandemic, I've branched out a little bit and get back to more integrated what was my previous profession as a web developer into my work today, and started working on developing a clinical documentation app that's ready for machine learning and all sorts of other interesting things that I could totally geek out on. I'm also back at McMaster University to finish a Master of Rehab Sciences that I started quite some time ago, and now it's the time for me to get back to that. Otherwise, when I'm not working, I spend my time with family, spend a ton of time outdoors, and still run, climb, and just love being outside. I think it's worth giving a brief disclaimer. Some of that information is potentially outdated. I've tried to sort of find the most up-to-date info in preparation for this presentation, but there may be some bits and pieces that are really just not applicable anymore. And I hope that some of the other two presenters can shed some light on that. And there may be some of my own views sneaking into this presentation here. So I'll talk about PT in Canada in general briefly. Then we'll talk about the registration and licensing procedure. I think there's a few pieces that I can still add there, because it's such a big and intimidating piece to the puzzle. I'll talk about ESP as preparation to enter and grow in Canada as a physical therapist, not just for the exam, but also afterwards for your career path. Continuing professional development options and work opportunities, and then that should bring us to the end of maybe about 15 minutes or so. So we have, well, in 2020, we had 26,000 registered physical therapists throughout the provinces and territories. Most of which work in a community setting, so in private care, that's 58%. Hospitals, we have 34% of the registered PTs working, and in long-term care, there's just 2%. And most of these registered physical therapists work in musculoskeletal care. 1 in 5 is internationally educated, so Canada is really quite open for internationally educated professionals. We have direct access of care, as it goes in many countries, so that comes with a greater responsibility, a higher requirement for an academic education, and then, of course, on the flip side of that, also with potentially greater remuneration of the services. Afshin has already brought this up. I believe the regulations they're mostly provincial, and some of it, especially the registration process, is governed on a federal level. On the provincial and territorial level, we have colleges that are essentially put in place to protect the public from the physical therapists. So they're the regulating bodies, and they also hold essentially copyrights on the different terminologies that identify physiotherapists, physical therapists, physiotherapists, and other terminologies, so that no one from the public can label themselves as such and potentially practice fraudulent care. PT, at least within the province of British Columbia, but I assume it goes for most provinces, is covered under provincial health insurance, at least in hospitals, in rehabilitation settings, long-term care facilities. And then workers' compensation covers work-related injuries, and motor vehicle accidents are covered by vehicle insurance companies. That said, most of these services leave a lot to be wished for, which is where private care then comes into play. And that private care is sometimes covered by private insurances that are sort of living on top of the provincial health insurance coverage, or is just paid out of pocket. The registration licensing procedure for international graduates. So Afshin has already mentioned the Canadian Alliance of Physiotherapy Regulators being responsible for this. The first thing I want to highlight here as well is the language assessment. You may come in, so if you have not completed your high school in Canada, or if you attempt to register with a PT education from a non-native speaking country, non-native English speaking country, you will have to go through a language assessment. I was lucky to have been warned about this exam about a week prior to completing it. And I'm so happy that happened, because it's a quite fast-paced exam where you have to understand just the working procedures of the exam. Otherwise, you could quickly just fail this thing by not understanding what is asked of you. So just if it turns out that you have to take this assessment, make sure you prepare for it a little bit. and it's mostly about understanding the pattern there. The required course, we've already discussed this, so I won't go into that. That's available at several universities. It's an online course. The piece, as boring as that course may be, there are quite a few important pieces covered that will prepare you for the examination process. So pay attention to some of that. The credentialing assessment times, from what I have found, vary a little bit. From what Afshin has presented, they seem to currently be at 19 weeks for both the written and the clinical, where the clinical obviously is not administered anymore by the Canadian Alliance. The physiotherapy competency examination, I will go into this briefly just a little bit. There's a few pieces I want to add to that. And the total time to register for me from graduation to practicing as a fully registered physical therapist was 1.5 years, starting in 2012. That seems to be still on par somewhat. I have a link here to the credentialing guide, the slideshow I can share with everyone afterwards, and that will be a quick way to find that. That's probably the most important slide that will highlight how important it is for anyone who's interested to register here to properly prepare for the examination. So as you can see here, only half of the Dutch educated student pass the written exam on first attempt, and even less for the clinical examination. Now, I don't see that as a reflection of the quality of education, quite the opposite, but there is a big discrepancy. So the Canadian educated student, they have 2 years in their master's level education, and they practice, and this is where my opinion piece comes in, they seem to be practicing mostly the procedural knowledge. If you see pattern A, you have to follow pattern A for practice, or for intervention, for the assessment, pattern B, you follow pattern B. Well, at least when I was at the ESP, we've been trained quite a bit different. There was a lot of ifs and buts, and what about this and what about that, and that's fantastic. I think that will make you a great physical therapist long term, but it will create challenges when it comes to passing these exams. So it really, you would do really well to spend some time and dive into a proper preparation procedure for this. So as already mentioned prior as well, there's no more clinical exam administered by the Canadian Alliance. However, that now is passed down to provincial regulators, and they may all have slightly separate ways to conduct that examination. So in British Columbia, for example, it's slightly different than it is in Ontario. They have simply taken the blueprint of the Canadian Alliance examination from 2018. And that is now administered at UBC. I don't know the frequency. That should be all fairly easy to figure out if you follow those links. But the procedure is the same. They're OSCEs, so I don't remember the exact number of stations, but you have quite a few 5-minute stations and 10-minute stations with a break in between. You're being thrown into the rotation somewhere, and then you have a clinical case presentation just sort of posted on the door that you have a moment to prepare for. You step into the room, you have a volunteer patient sitting there and an examiner, and you are expected to go through all the procedures of whatever the case requires. One of the general tips I'd give you, and I expect that probably hasn't changed much, when you step in there, take a moment. Don't just jump straight to addressing the patient. Have a look around the room. Quite often there's a bits and pieces of equipment sitting there that will give away half of what's expected of you. And the written component, I think Afshin has covered already the fact that it's a lot of ethical questions. That was the same for me in 2012. So by the sounds of it, they really haven't changed that all that much. There's a lot of regulatory questions, and the rest were clinical questions. So the preparation coming from the ESP, it makes it a bit more difficult for the examinations to prepare for that. it really pays to properly prepare for that, because you'd be losing a lot of time if you have to redo one of the rounds or possibly even both components. You're really just losing a lot of valuable time that you could actually be working as a therapist. So really spend your time to prepare for that. In 2012, there were courses around that were offered by universities that prepared you for both of the examinations. I would highly recommend that you try to network with Canadian educated PTs. They will have a fantastic insight into the practice procedures that are expected for you at the examinations. So that's time well spent. And the Alliance has a bunch of resources as well. And below that, there's also some historical examinations sort of floating around between the student or amongst the students, and that's well worth tapping into. And then a lot of just a lot of practice for the clinical examination pays off. When you enter the profession, you will likely see the same discrepancies. You may find a little ill-prepared for the practice patterns in Canada, where you have a Canadian graduate next to you and they're just on fire. They have all those practice patterns ingrained into them. They seem like they've been working there for 10 years. And you may seem a little lost because you're busy establishing your own guidelines based on the clinical scenarios that you're encountering. And then after a bit of practice, there seems to be a gradual shift where the benefits of having had an education that focuses on evidence-based practice, critical thinking, and all those big pieces, that will, from my perspective, set you ahead long-term. So once you've found your groove in your clinical practice, wherever that may be, that's where you can then really benefit from all these tools that you have been and will be taught at the ESP. And that will really allow you to continue to progress, not just through the world of a physical therapist here in Canada, but then also within healthcare in general, and really allow you to move beyond just, and I don't mean that in a degrading sense, just being a clinician. Okay. Continuing professional development, I at least want to briefly say a few words about that. There's no well-established specialization program in the country. Now, there has been one around that is administered by the Canadian Physiotherapy Association. They have a clinical specialty program. But really, when you look at the numbers, this program has been around for, well, at least as long as I've been a therapist, so for at least 10 years. There's by now 44 clinical specialists in all areas of specialty. Most of them sit within MSK. So that means really there's less than 2 per 1,000 PTs listed as clinical specialists. The universities have great educational opportunities in related sectors. So we have McMaster's here, of course, in Ontario, with where Sackett, the father of EVP and EVM, was working. University of Toronto, McGill, UBC, many other universities that are all top-tier universities internationally, especially also in healthcare. We have the Physiotherapy Association and the provincial branches offering courses. You have to take those listings with a grain of salt. When I look through those, there's a lot of great courses there, and lots of opportunity to grow that way. But there's also a lot of stuff where you really wonder, from an evidence-based practice perspective, what are they supposed to be on? Where are these courses taking us if that's where we're heading? I'll use your own judgment when it comes to picking the courses there, but there is some good stuff out there. You just have to sort of cherry pick. Work opportunities. So we have a broad spectrum of opportunities, with most of them sitting in musculoskeletal care. Just when I looked a couple days ago in preparation for this presentation, we had over 100 postings in British Columbia alone, and that was a mix of privately offered positions and positions in public health. I couldn't really find any comparative data, so I'm not really sure how to put that in perspective to to other jobs in healthcare or to physical therapy in other countries. But that's just it's just a number that suggests that there's a lot of good opportunities. Personally, I've experienced that over the last 10 years, being consistent, that you should be able to find a suitable job as a physical therapist, wherever you are, if you're somewhat flexible. An income potential, just as a ballpark figure here, postings from Vancouver Coastal Health, which is our regional health authority here, they post entry-level positions with $36 to $45 per hour starting wage, and then on top of that, you have benefits that would then include a pension plan, and as well as medical benefits. As mentioned earlier, there's stark limitations to what's covered under the public health insurance, and you do well to have additional coverage. And most of these postings in healthcare, and that would include physical therapists in public health, have fantastic benefits. Private sector, that's a tougher one to comment on. It really varies greatly based on whether or not you're completely self-employed. It obviously depends on your overhead. It depends on if you are in an employment or subcontractor position in an established clinic. And there, a good starting point for you to spin some numbers around is the fact that, at least here in British Columbia, an hour-long physical therapy session could easily cost you between $120 to $200 as a patient. Now, that may seem outrageously high to some of you, and it is, but when you put that in perspective to the cost of living in British Columbia, that all gets normalized quite quickly, because it's just brutally costly to live here, for lack of better terms. Okay, so that was a whirlwind through the profession as a physiotherapist in Canada. I'm going to leave it up now to you guys to throw some questions at me. And then this presentation is shared at that domain if you want to get back to some of the resources that I've linked to.
All right. So we'll move on to our final speaker, which is Carolyn. Carolyn also graduated in 2012 with Pascal and moved back to Canada. She now owns her own practice in Barrie, Ontario.
Hi, everyone. My presentation is going to be a little bit different from Pascal's, because I knew I could count on him for all the statistical analysis and norms and values and everything about applying for the PCE in Canada. So mine will be a little bit more functional about what work is like in Canada and how I went about building my own practice. So I graduated with Pascal in 2012, and I immediately came back to Canada, and I decided to apply for the PCE with Pascal. So we went through the whole process, which was sort of new to ESP at the time. And I think we did it with Bob and Yessa, I think, at the time. So we were kind of creating a new standard of what to apply for and what to include. And the process was actually quite quick for us. I thought so anyways. And we were approved to write our written and complete our clinical together. So we spent lots of long hours at night, on the weekends, during the day, studying, going back and forth with practice questions. And like Pascal, my biggest advice is practice, practice, practice the way that the Canadians practice. I really do feel that we got such an excellent education through the ESP, perhaps better than the Canadians. A lot of differential diagnosis, different perspectives of physiotherapy care, lots of community access that the Canadians don't get. However, we don't learn to assess the way that they do. Their acronyms, the specificity of what they're looking for, the jargon, that sort of thing is something that we didn't have. So I actually did a course through PT Health. I think they're nationwide. And I learned how to do the clinical exam. So my first round of the practice courses didn't go so well, but I learned what IPPA meant. I learned what all the Canadian terms meant, and I learned how to apply it to my clinical. So a bit of a funny story about the clinical. Pascal did his in BC and I did mine in Ontario. So we immediately called each other after. How did it go? What did you think? And I was out of sorts. I was sweating through my lab coat, to say. One of my stations was to assess the gross motor skills of a child. So Pascal, I don't know if you had a doll or if it was a human, like an adult. Mine was a screaming 2-year-old who screamed the entire time and cried and threw a temper tantrum, and I lost my cool. I couldn't think of anything. I didn't know how to assess my stroke patient the next station, and it was horrendous. My next station was a man with a stroke, and he kept saying over and over to the presenter that I wasn't speaking English. So here I am, this internationally trained physio, and no one can understand me, and I'm frazzled, and it was a nightmare. So walk in prepared, walk in confident. Those are my biggest advices. So along with Pascal, I did my master's degree as well. So I completed mine in 2018. I did my special project on concussion management. And as Pascal said, there's not a lot of specializations in the Canadian Physiotherapy Association, but I do hold a specialization in Chinese acupuncture. So I do quite a bit of acupuncture with my patients. And I did a specialization, which is not acknowledged, but I did it on vestibular rehabilitation. So I went down to Emory Medical School in Atlanta, and I focused on central vestibular rehabilitation, peripheral vestibular rehabilitation. And when I came home, I did quite a number of courses on cranial sacral therapy, advanced cervical therapy, assessment and treatment skills. And I created basically my own practice of concussion management. It took me probably 4 years and about $30,000 in extra courses. And I worked in a specialty clinic with a number of sports docs and other specialized physiotherapists. And we treated athletes with concussions, head injuries. And it was a super great experience. In 2019, I got pregnant and had my first baby and just found it to be overwhelmingly busy. So I opened my own practice. And that clinic ended up closing, so it was a great thing. And that's what I do now. So I love it. One thing I wanted to mention when you're thinking about practicing in Canada is really choosing internships that are best suited for what you want to practice or where you want to practice. For example, I knew I wanted to do some sort of sports therapy, whether it was manual therapy or injury prevention. So I focused my internships on those types of areas. So even though I wasn't, it was a little bit of a tricky situation, but I did my first clinical internship in Ontario. My second one was in the mountains in Germany, and my third one was in a hospital in Florida. I made sure I crossed all my T's and dotted all my I's so that I could pass that clinical component. I made sure I had a hospital, cardio, and sports. And one of my biggest advices for all of you who are thinking about applying to Canada, when you are on internship and you see a cardio patient, go to a piece of paper and write down how many hours you were with that patient. When you see a sports patient, write down how many hours. When you're with a neuro patient, write down how many hours and keep a strict spreadsheet of those hours, because when you go to apply, it's important that you're not just guessing. It's important that you're coming here as a prepared physiotherapist. So if you've kept track of that, you're very prepared for the application process. So if anyone has questions on internships and where to do them and advices, the three of us can probably help you. We might not have great advice because it was a bit of a nightmare for us as well. So the process, Pascal's already gone through, so I can pass all of these slides. If you have any questions, you can ask me. Basically, same sort of questions. You don't know what to expect. Lots of vignettes, tough questions, tricky questions. My best advice is take a deep breath and try your best and stay as calm as possible. So I'm open to any questions about jobs in Canada, wages, opportunity, any sort of postgraduate studies. I really focused a lot of time and effort and money on this so that I could be a little bit more specialized in my craft. I wanted to be able to make the most amount of money without having to work crazy long hours in a clinic or in a hospital. And I wanted to be a bit of a niche. So I wasn't doing low back and shoulder and knee and hip and ankle in the same day. I wanted to be very specialized in something. So I'm open to any questions about that as well. I did spend quite a bit of money. So it's, I don't know, a choice, but when you graduate, you really don't have any money, but it's great for the long term. And I'm 10 years into practice, and I'm so grateful that I took that hit and accrued a little bit more debt to be specialized.
I don't really have a question, but I just wanted to say thanks to Carolyn. Afshin left, I guess, huh?
Yeah.
Yeah. Thanks, Carolyn. Thanks, Pascal. Great to see you. Good to see your family
Thanks
as well.
for having us.
Carolyn, who's that?
I'm on baby duty. This is Cole. Say hi. Hi.
Hi, hi. Well, enjoy your time. And same for you, Pascal. Let's keep in touch. And thanks for your contribution. Great to see that you're
Yeah,
still,
absolutely.
still the
It
same.
was great to see everyone. Reach out if anyone has more questions. Always happy to chat. I hope there was some value in it. I feel a little outdated with the process, but I hope there was something of value I was able to add. It was certainly great to see some familiar new faces as well.
Cool. Very nice, yeah. And just for everyone to know, the recording will be shared later. We will edit the talks so that it's a little bit more compact and then share that with you. So any of the slides or whatever we can share together with that same package. So don't worry if you didn't take notes, we will bring them to you. Back to you, Katie. All right.
Perfect. All right. Thank you, everyone.
Enjoy your evening and
Thanks,
during the
everyone.
day, the rest of the day in Canada,
Thank you.
we're done.
Thanks a lot.
Bye, everyone.
Guys, bye bye. Thanks.
Bye, everyone.
Ciao.
Bye.
Bye-bye.